Facebook and YouTube. You are all warmly welcome to Let's Talk About Health, which is streaming live from London, UK. Tonight, I'm a bit excited, actually, because it's a very, very hot sunny day in London, and we are all really feeling the heat. And it promises to be a very exciting episode of Let's Talk About Health. I'm your host, Mrs. Winnie Ohinekisi. I hope you are all joining me. I want to acknowledge the presence of a few people who I know will be watching on live now. And I will start this time because you always give me a stick. Start with some school groups from back home in Ghana. I know a lot of Morgans and Fansman old girls are watching. I know a lot of Absunians are watching. Is it St. Augustine's College? They are watching. And I do know that Opokuware Secondary School and T.I. Ahmadiyya Secondary School people will be watching as well. I welcome you all on board. I want to also say that this is coming to you by kind courtesy of Omega Live Multimedia, Omega House based in London. And it is also proudly sponsored by World Remit. World Remit is our main sponsor for Let's Talk About Health. And World Remit, you know a lot about them already. If you want to send money to your friends and family back home in Ghana, you don't have to use any other service but the services of World Remit. We also have Base, who also sponsors this show, and Cosmet Cocktail sponsors as well as Swache Joint, based in Seven Sisters here in London. So I welcome you again. So now I've acknowledged all these schools that are watching. I want to also acknowledge the viewing of a number of nursing groups as well. And I'm proudly involved with Western Region Association of Nurses UK, all trained in Efian Kwanta Hospital in Ghana, and especially Philomena Chumesi, Jenny Otu, Elizabeth Jechi, Eunice Hagan, Dr. Sapia, Jane Asirifi, Evelyn Asiedu. You are always supporting me, so I really, really do appreciate you. I also want to acknowledge these people: Amma Folsen, Adelaide, Amma Bonnie Ouswachem, Angelina Brobe Anan, Eugene Oforiata, Kojo Teming. All these people are always backing me and watching the show. So before we start and look into tonight's show, I want to say a big thank you to Dr. Tonyin Ayebisi, who was the dentist who featured last 2 weeks actually, on Let's Talk About Health. It was an awesome session. If you haven't watched it yet, you have missed a lot. So I suggest you go back on our page, Omega Live, and watch it again. Dr. Tonyin, thank you so much. And if you didn't learn anything at all, stay away from chewing bones. Was one of the big lessons I learned. Stay away from chewing bones because you are at risk of breaking your tooth, and the consequences of it can be very fatal. Tonight is a very important topic, and I've been waiting for this one actually, because everyone at one point in their lives will be involved with medication, whether personally or through a family member needing to be treated with medication. So this topic, it's massive and one that is very dear to my heart. And to help me go through this topic, we have two very fine gentlemen with me. I'll let them introduce themselves. Please, gentlemen, you are very welcome to the show. It's Omega Live TV and it's Let's Talk About Health. You are welcome. If you can tell us your name and where you're coming from, what you've been doing, that would be great.
My name is Andrew Chumesi. I'm a community pharmacist based in Barking, Essex. Yes, I'm based in Barking, Essex. I have a B.Pharm degree from the University of Science and Technology. I graduated in 1993, and I worked in hospital till 2002 when I moved to UK. I did my conversion exams in Sunderland in 2003, did my pre-registration training in South London, and I started working in UK as a community pharmacist in 2004. I worked for a company called Britannia Pharmacy, but in 2006 I went back to university, I did a course in anticoagulation management at University of Birmingham. So I am an anticoagulant practitioner as well in primary care. Also in 2017, I went back to university to do an independent prescribing course at Robert Gordon University in Aberdeen.
Wow.
So in addition to being a pharmacist, I'm also a prescriber.
Oh, wow, wonderful. And if you can also introduce yourself,
Thank
please.
You and good evening. My name is Francis Boachiyado. I'm a clinical pharmacist. I'm an advanced clinical pharmacist. I work in general practice. I work for the Holy Surgery in Benfleet. I have a master's degree in clinical pharmacy.
Oh, wow.
And I have various postgraduate courses.
Trainings, a whole lot.
A lot of them. So, in a whole lot of
that could fill a whole show.
Yes,
I did see it when you sent me all the details. Yes. Gentlemen, you are all mostly welcome to the show. I'm so happy you are here because medication is a big thing in treatment, in health treatment. And Andy, especially for those of us who are here in the UK, there are so many health services that are at our disposal. So today I want us to take the show in two parts. And the first part, if we can look at some of the treatments that can be offered by pharmacists rather than say going to the GP or going to the hospitals. And then the second part, which is also extremely important, is medication review. So I think I will let Francis, you look into that for me. So I'll set the ball rolling. If you can tell us, especially for those of us in the UK, but I'm sure definitely pharmacists worldwide will probably be doing the same thing. So what are some of the services that one can have at the pharmacy?
Okay, so basically at the pharmacy you can treat ailments, especially minor ailments. You can go to your chemist to get medication for minor ailments. There are certain ailments that you don't have to see your GP for. You can just go to your local chemist and they will be able to help you with your disease, whatever symptoms you have, they will help you treat it. Apart from that, we offer a sexual health service as well, where the patients can come in for the morning after pill and the condoms as well. We have that service as well. And also we have a medicines use review. If you have medication, you can sit down with your pharmacist to talk about your medication.
I think we probably have to take it one after the other. So if you can take one of them, we break it down so people know the details of those kind of services, and then it can be useful to them.
Okay. Yeah. First of all, let me talk about treating minor ailments in a pharmacy. So basically, if you have a minor ailment is a common condition, uncomplicated condition that can be treated with over-the-counter medication.
Okay. For
example, coughs, colds, headaches, sore throat, hay fever, and the list goes on and on.
Okay. So in this case, do they need to book an appointment to come and see the doctor?
No, the good thing about pharmacy, using pharmacy services, most services you don't have to book an appointment. You just walk in and maybe you
it's a walk-in service.
Yeah, it's a walk-in service. Maybe you may have to wait for a while, and the pharmacist will see you and talk to you. For example, even if you want to speak to the pharmacist in private, we have a consultation area where you can speak to the pharmacist in private as well.
Okay.
Yeah. Let me touch on this minor ailments thing. Like basically, if you have a cough or a cold or any ailment, minor ailment that you come to the chemist with, we just don't give you any medication at all. First of all, we want to know who the patient is.
Yeah.
Is the patient a child? Is it an adult or an elderly person? We need to know. Or maybe it's a pregnant or a breastfeeding mother. We have to know, so that will give you something appropriate for your the condition.
Right.
And secondly, we want to know what the symptoms are. Do you have a cough? Do you have cold? Do you have cough and cold? Do you have headache? So we want to have to know what exactly the symptoms are, so that we can offer you your medication.
So by this, is there any systematic kind of review? Is it a systematic review? What's the criteria for this consultation?
Oh, there's no criteria.
There's no criteria.
You just come in, but the pharmacist will go through this. It's an informal consultation.
Right.
Yeah. The pharmacist will go through this informal consultation with you. So after getting to know your symptoms, we want to know how long you've had the symptoms for. If it's an ongoing problem, then it's likely that you have to see your doctor.
So you are trained to know when to refer.
Yeah, we
to
are
the
trained
hospital.
to know when to refer to your GP. So if, as I said, if it's an ongoing problem, we'll have to refer you to your doctor. If it's something that you've had it for maybe a couple of days, we can give you some form of treatment. And also we want to know what action you've already taken, whether you've already used home remedies. For example, someone with a cough will tell you that they've already had what do you call it? They've used home remedies like honey and lemon. You want to know, or maybe you've already had over-the-counter medication. For example, for pain, you've already had paracetamol. We can give you cocodamol, which contains paracetamol and codeine, which is stronger.
Okay.
Yeah.
So is it safer to do this consultation than to buy anything off the counter to use?
Yeah, that's why pharmacists are there. We are trained to help you. So everyone is welcome. You don't need an appointment. We have long opening hours. You just walk in. They say that you can either speak to the pharmacist. The counter staff are also trained as well. They can help you. If they have any problem, they'll refer you to the pharmacist. Or the pharmacist can just say that you want to speak to the pharmacist, and the pharmacist will help you out. So lastly, regarding the minor ailments, we want to know whether you have any medical condition or you are taking any medication for any medical condition. For example, if you have osteoarthritis and you take paracetamol for it or cocodamol, we can't give you any cough remedy which contains paracetamol. Most of these cough remedies contain paracetamol. We can't give you anything like that. And also, if you have high blood pressure, we won't be able to give you any decongestant containing pseudoephedrine because it makes blood pressure worse. And also, if you have stomach ulcers and you want something for pain, we won't be able to give like an ibuprofen or an NSAID because it can make ulcers worse. And also, maybe you have high blood pressure and you want something for indigestion or heartburn, we won't be able to give an antacid which has high sodium in it because if you have high blood pressure, high sodium is not good for you. Increasing your sodium levels will make your blood pressure worse. It will make your blood worse.
So the reason why they cannot get anything anyhow.
It's good to have a consultation with a pharmacist.
Okay.
It's
So
beneficial,
it's very important. I mean, drugs have a very big effect on the general health of people, and that is why this topic is very sensitive and is very, very important to me, because I know there is a practice of people just purchasing anything off the counter to buy, whether it's online or in the shops. How safe or unsafe is this? I mean, I said we will be taking it in two parts, but if you can help us with that, how safe or unsafe is that kind of practice?
To be frank with you, it can be unsafe because drugs are good. They help people, but drugs have got side effects as well.
Yeah,
and even common drugs, common medications like ibuprofen, paracetamol.
Yeah,
if they are not taken the right way, or the right person is not taking it, they can cause serious side effects. So I will suggest that if you go to a pharmacy, like Andy was saying, it's better you speak to a pharmacist. Speak to the pharmacist. The pharmacist will have substantial information about you. They also have a lot of clinical knowledge as well.
Yeah.
So they can advise you and they can give you probably an alternative for the same indication or the same problem that you had, but not the one that can give you the problem. So I think just walking in and buying anything, I mean, I'll go later on, I'll go more into deeper into drug interactions.
Yeah.
And how, just picking up things from the shelf, how it can cause problems.
Yeah.
Yes.
I think we'll probably start and go into the medication reviews, which is very important, whilst we try and sort out Mr. Chumesi's technical problem. So medication review, why is it necessary to have medications review? What is it about, medication reviews? What are they about?
Okay, so basically when we say medication reviews take place generally in general practice, in what we call in the UK a doctor's surgery.
Right.
So they take place in these places. What happens generally in medication reviews, simply put, is this. So you have a patient, you talk with the patient, you critically go through the medication the patient is taking.
All of the medication.
All of the medication.
This
includes the prescribed medications, the one they are buying from the pharmacy, over-the-counter medications. If they are taking herbal medications, are they buying anything from the internet? We look into all that. But the whole thing is that we want to make sure that the medications the patient is taking, the patient, one, is getting the best from it. We also want to know whether medication generally can cause side effects. We want to minimize the side effects or get rid of them.
Yeah, completely.
Completely. It's not always possible to do that, but you want to minimize them. Sometimes you can get rid of them completely. So that's the second thing. We also want to know if the patient, is this even the right medication for the patient? Or is it the most effective medication for the patient? But we also want to listen to the patient.
Yeah.
This is where we want the patient's voice. We want to know how is the patient feeling. I mean, I have written prescription for a patient where straight away it doesn't come across to you. Do they even have dexterity problems? Can they open it?
Right.
If it's eye drops, are they able to apply it well? These are things that you need to get from the patient.
Yeah.
So you can give the best medication in the world. If the patient cannot use it right, it's not going to work.
No,
so
it's not.
These are some of the things we talk about. We really want to know. And also, during the medication review, we are equal partners at the time. So because we want to listen to the patient. The patient might not even be able to swallow tablets. We are writing tablets. Are they taking it? They may not be taking it. But the point is, if we don't look at these things, the ripple effect is huge.
And what effects can possibly happen?
Well, they may not. They may not be taking the medication to start with.
Yeah.
And we know in the UK that prescription that we prescribe, 50% of them are not taking the right way. 50% of medication.
So these are medications that have been prescribed by a GP.
Yes.
But through the review, the pharmacist learns that the patient is not even taking the medication at all.
Yes.
Okay.
Reviews in general practice are done by clinicians. So it could be a clinical pharmacist, it could be a general practitioner. So any of us may do the review. But we find out about 50% of the medication we prescribe are not taken the right way. But it's also more than that. They could be taking it the wrong way.
Right.
So
if we can cite examples of how medications can be taken, say, in the wrong way.
Okay. For instance, you can have, if I prescribe, whenever I prescribe something like naproxen for a patient.
It's a painkiller.
It's a painkiller for pain. Because it can affect the stomach, I always tell them to take it with food.
Right.
So, and again, I will say that one of there are 4 main drugs, including pain relief. We call it ibuprofen type of pain and naproxen group.
Yeah.
They are one of the medications that lead to hospital admissions a lot because they cause bleeding in the stomach.
So by this we are talking of like ibuprofen,
naproxen, In some places, diclofenac, we don't write it a lot in the UK, really, diclofenac, but in some places that is also, people can even buy it.
Yeah.
So if the patient, for instance, is not taking this with food, we know the implications. So that can be serious.
So if we can just point out some of the implications of people not following the right instructions for their medication, because I think these are the things I want to come out clearly. You know, and you did say, for instance, about naproxen. Why do they have to, you know, take naproxen with food?
Because if naproxen is not taken with food, it can cause stomach ulcers. It can lead to bleeding, and it can be serious. If you are bleeding and you are not aware of it, it can be serious. So, but it's not only naproxen. There are many other things.
Ibuprofen does the same thing, isn't it?
Does the same thing as well. And so this is just one class of it. And then you can have other medication that can affect the kidneys. It can affect the liver. But during the medication review, that's another thing we do. We do what we call monitoring. So if we need to do blood tests, we'll do blood tests to find out, are they affecting the kidney, for instance. We know some medication will affect the kidneys, but we monitor. There are some blood pressure medications, if I prescribe it, the patient will have to check their kidney function 2 weeks on it to see whether everything is fine. So we look at these things. We also look at whether, if I've written a medication for blood pressure, is it working? Is it even the right one? Because certain medications work better for certain group of patients.
Especially on Africans, isn't it?
Exactly.
Yeah, when it comes to blood pressure medication.
Yes. So there are certain medications, research has proven that if somebody who is more than 55 years, 55 and above, or somebody who is of black African origin, certain class of medication work better for their blood pressure control. So that is the one we start with. I have come across patients where that hasn't been the first one. So the question you ask is it because they had a side effect from it, or was it an error on our part? And then we look at it. We sort these things out. So these are also some of the things that we look at as well during the medication review. It's quite broad, as you can imagine. We are trying to find out whether the medication is working, the side effects of it, any problem they have, the monitoring aspect of it. So it's a lot can go in the medication review.
Obviously, from my nursing point of view, I know a drug that we commonly take, and two of them actually, like paracetamol and ibuprofen, cause a lot of problems. And I have actually nursed people having very bad side effects from just these two off-the-counter simple medication, you know. And the instruction is generally you can take paracetamol like at 4-hour intervals, but sometimes people forget that the maximum dose you can take in a 24-hour period is like say 2-4 times a day, depending on your weight. If you have a very good weight, as in above 60 kilos, 70 kilos and above, you can take the full gram, you know, 2-4 times a day. But the problem is sometimes people are in so much pain and they are taking 4 times a day. So every 4 hours they are taking it, and then they have the effect of paracetamol overdose, which needs very, very thorough medications to give, which can't be done in the community or at home. You have to be in a hospital. So then the person puts it down as, say, an allergic reaction to paracetamol, but it is just the instructions that haven't gone quite right. Who orders these medication reviews? Who orders them?
That is a very interesting question in the sense that this is how it should work. It doesn't always work like that. So if I do a medication review for a patient, so in the UK, in the patient medical records, we have a particular place we call the repeat medications template. So that area has got all medications that the patient is stable on. We know that this patient, we are treating blood pressure, we are treating COPD, we are treating asthma, we are treating diabetes, whatever we are treating. these particular medications and their doses have been able to control these long-term conditions quite well.
Yeah.
And the patient is tolerating them quite well. So they go into the repeat medication template. That is where they will be. After the
at the surgery,
it will be at the surgery. It will be on the patient medical records. That will be one area that will be there. It will be at the surgery. So that will be that will be there. It will be at the surgery. But even there have been occasions I'm working out of hours. When you're working out of hours, you will see them as well. So it will be on the patient's medication records, so it should be there. What happens is that when you come for the medication review, if we go through everything and if we think something is not right, we will take it off the repeat medication template. If everything is right and whatever we keep on the repeat medication template, we should put something like a lock on it. What I mean by that is this. So the patient should be able to, because they are stable on it, the patient can order it, say monthly or every 2 months.
The patient has to order it.
It can be either the patient or the community pharmacy can order for the patient. Or they can send an email. They have to be a system by the patient has sort of generated. Either they will have to send an email to the surgery. They will have to arrange with a community pharmacist for the pharmacy to order on their behalf. Or they can also order online. We have online service now that the patient can go in there and order it.
Right.
Because they are stable on it, they can order that for some time, but we lock it.
Yeah.
Up to say 6 months, maximum to a year. The patient, after that period, they shouldn't be able to order it again.
Right. So it will call for them
to will call for a review. Either we will send a message to the community pharmacist. So when the patient is going to pick up the prescription, there will be a message for the patient that they cannot order it again. They need a medication review. Or when they try to order it online, there will be a message there. Or they will try to order it through the surgery. A receptionist or somebody will send a message to them. So there should be a system like that. It doesn't always work like that, unfortunately.
No.
And that is why I will say patients should be a bit proactive here.
Yeah.
Because it doesn't always work. There are some cases where the lock is not put in there.
Yeah.
And if you are taking medications, whatever they are, if you have been on it for a year and you haven't been reviewed, it's not right. You will have to, if that's the case, the patient will have to be proactive and ask for a medication.
You see, and that is what I want to come out clearly from this, because obviously I am particularly concerned about our people back home. And I must say that this is the inspiration for doing this show, actually based on what I experienced with a family member. You see, I'm so worried because we are talking of the UK here, and things can even go out of order a little bit. Like if this lock or check is not put in place, then this review is not going to happen. You see, back home in Ghana, I'm sure everything has to be by, you put yourself, like, be proactive and order it. See a doctor for the review to happen if there is anything like that. And that is what is very, very important to me. So in a case like in Ghana, what should people take note of?
It's because, like you said, the UK healthcare system is one of the best in the world. It's one of the best in the world. But even here, a lot of things happen. We know that there are about 237 million medication errors that happen. Medication errors that happen in England alone in a year. Don't get me wrong, many of them are not serious errors. But out of this, it's the statistic. The research says that about 66 million of them are potentially serious.
Right.
This is one of the best healthcare systems in the world.
Yeah.
And they have some of the best records of our patients. So in countries where we don't have records of allergies, we don't have records of maybe proper records of long-term illnesses. If the patient is asthmatic, they go to see somebody, They don't even, they might not know. If the patient doesn't say, they might not know. They may write something that can be serious for them. A patient with a history of, say, stomach ulcer, hiatus hernia, they may end up with naproxen, ibuprofen. When there isn't that sort of that record, that can be. And one point that I would like to say, because of these things, I would like to say that if you are a patient, you go and see any clinician, as much as doctor, pharmacist, nurse, as much as possible, give them as much information as possible. Give them information about yourself a lot. Also, let them know medications you are taking a lot. It helps you. It helps them. I mean,
especially any time something new happens with your body, any new thing in your condition.
Yes.
Yeah, and when new medications are being added on, isn't it?
Yes, and that is another thing as well. Sometimes there's something we call reconciliation. So a patient may be on some medication for, I don't know, a year. They go to the hospital, things are changed.
Yeah.
And there can be a gap of communication between the hospital and then maybe general practice. The patient should ideally be aware of it, or a family should know this, so that if the information is not in yet, or it hasn't been acted on yet, the patient has got the information. So I think empowering patient is huge.
It's key.
It's good for clinicians. It's good for patients. And if there's anything that I would say here is, I think one thing is, we should aim to empower patients. Really. They should know what they are taking. They should know their body. They should be able to feel free to communicate with clinicians. They should be equal partners with clinicians. I think that should be the way forward. Yeah. And on the part of patients as well, I would say that, again, because of side effects of medication, because everybody has got different conditions, I think we also need to bear this in mind, that we are all different. We are individuals. Yeah. We are different. If you go to the hospital and you are given something for headache, it was for you. It was for you.
It is a very common practice, isn't it?
Exactly.
The family members sharing medication.
Yes. Yeah. It's for you. Your liver function might have been taken into consideration. Your other illness might have been taken into consideration and prescribed for you. It could be the same condition.
Yeah.
I see patients with back pain, the same back pain. My prescription is different. My management is different, because I've got different age groups. I've got people with different renal function. I've got people with different other health conditions.
Allergies.
So my prescribing will be different. My management will be different for the same condition for different people.
Yeah.
And I think we need to bear that in mind, that we shouldn't be sharing. That is something that we
they are
need
not
to look
sweets.
At. They
are
sweets.
Serious stuff.
Yes.
Yeah. And anything going into your body, you must know the dose, the right drug, the right time to take it, any other information. Because I mean, I've said this on this show so many times, where I had a family member who was taking the same medication but with the generic, the two different names, and it had very, very bad effects, and they didn't know. So it does really worry me. Anything to do with medication, how do we get people? And compliance is another thing, because obviously if you haven't taken the medications well, then you have other side effects which would not have normally happened. How do we get patients to comply? Because if it has an effect, then the compliance will be low. They wouldn't take it.
I think the first thing, like I said, is to engage the patients. I'll be honest with you. These days I use the word concordance instead of compliance. I use the word concordance, because sometimes compliance as if they need to listen to what we are telling them to do.
And take it as it is.
Exactly. We need to come to an agreement. We need to work with them. And I think that is the key. When patients know that they are respected, their views are respected, they are happy to participate. That is the first thing. So that is also why we need to listen to their concerns. But we also need to also give patients more information. That is the communication bit. It's happened to me before. I mean, I remember I wrote a prescription for a patient for a medication called gabapentin. For it was for this patient's pain.
Nerve kind of pain.
Yeah, it was pain. I explained to the patient well how to take it. I was titrating it, the possible side effects, everything. What I left out was that that medication has been used in the past for epilepsy.
Okay.
And the patient obviously read the leaflet. I'm managing pain, he's got pain. And he read that it's for epilepsy as well, and didn't want to take it. So, I mean, the thing is, I had actually made an appointment to speak to this patient on the phone in 2 weeks' time to find out. I spoke to the patient, and the patient said that, unfortunately, he's still in a lot of pain. I said, why?
Because they are not taking
it. He didn't even tell me straight away that he hadn't started taking it.
Yeah.
And then I said, why? He said, oh, I haven't taken it. I read that it's for epilepsy, and because it's for pain. I said, oh, you could have 2 weeks, you could have gone back to me. Did you ask the pharmacist? He said, yes, I did, but I didn't, you know. So communication is key. Communication is key here.
Yeah, definitely.
And also patient empowerment is key. Once they know that we are partners, compliance will improve.
Compliance, we would hope so.
Yes.
Yeah. So the key is people should take charge of their own bodies, and especially when it comes to medication. I think towards the latter part of the session, we will look at food-drug interactions as well, because that's very key. You know, so many common foods and their effect on the body when it comes to interaction with drugs and, you know, all sorts. So I think we'll pause on the medication reviews, and then we will go back and look into some of the services, because we had a technical hitch, so yeah, we had to break off from that. But we looked at some of the minor ailments, isn't it, that people can go to a pharmacy, especially here in the UK. And what are some of the other services that they can get from the pharmacist as well?
Okay, we have this service called medicines use review. It's to complement what the doctors do. So basically, if a patient can bring all their medication and we sit down with them and discuss their medication with them, how they take it, when to take it. Because some medicines should be taken before food, after food. Some medicines to be taken at night, and things like that. We go through with the patient, and we also check on their compliance as well. Check on their compliance, whether they're taking the medication and whether they're taking it in the right way. Check on that as well. We also have a new medicine service. So if a patient is prescribed new medication by the GP, we go through the medication with the patient to let them get an idea what the medication is used for, and then how to use the medication. For example, if you are prescribed inhalers, we can help you with when to take your inhaler, the inhaler technique.
Yeah.
And
the inhaler technique.
Yeah,
because
inhaler
2 weeks ago we had a dentist here, and one of the things that came out for asthmatics was how to take their inhalers and how to wash their mouth after using all these inhalers.
Especially with the steroid
inhalers.
Yeah. If you take steroid inhalers like beclomethasone, after using it, you have to rinse your mouth, to prevent you from getting oral thrush. Steroids can give you oral thrush.
So in terms of technique, what can go wrong if they are not doing it right? Like, what sort of technique do they need to know when it comes to inhalers? Is there any help for that?
Yeah, so basically with the inhalers, you have to breathe out first before you use it. You have to breathe out, and you put the inhaler in your mouth. You wrap your lips around it, and you take in a deep breath, and you hold it for 10 seconds. But with children and elderly, they have devices like the aerochamber device.
The spacers.
The spacers, which helps them with the inhalation. And usually, if you're about to use the inhaler, you have to prime it. Priming means that you have to maybe spray 2 doses, 2 puffs
off, just out, right?
Out, just into space, and then so that you know it's working before you start using it. And if you haven't used it for a while as well, you have to clean it. You have to clean it and prime it before you use it. So these are some of the simple things that we can help
when it comes to
patients. Inhalers. Right. And with the other medications, like maybe aspirin, you have to take with food or just after food. Yeah, we had a patient who was taking aspirin before food, and it was the soluble aspirin, and they were taking it with warm water. Aspirin is acidic, so it can erode the stomach, and it's you are taking it with hot water as well. So I think the patient had complications with like gastric ulcers. So just simple things like that. Instructions that people need to follow. There's one called alendronic acid. Alendronic acid for bones. We call it a bisphosphonate. You have to take it in the morning before food. You have to take it whilst standing upright or sitting upright.
And with a lot of water.
With a lot of water, because it can stick into the throat and cause problems with the esophagus. So simple things like that. We have education on. And also we provide travel health service as well. That's a private service that we provide. So basically, if you are going back home, you have to do your vaccination. So you can see a pharmacist, and the pharmacist will check on your vaccinations, the ones that you need to have, whether you need to have boosters to help you with your travel, to prevent you from getting any of these typhoid and polio, yellow fever, and things like that. And also malaria. We help malaria medication as well. We can give you malaria medication for your travels. And we give you advice as well, like how to prevent malaria bites using insect repellents. We also help with like using sun creams and things. Yeah.
So any other services apart from these travel services? You mentioned earlier about you've done minor ailments, isn't it? I think your mic is not picking very well, so I think we're struggling to help you. So you probably need backup in the form of that as well.
We have so we have the anticoagulation service as well.
Okay.
But that's a specialist service. So patients taking warfarin, they can come to our clinic and we test them and we dose them as well. For their warfarin level, but that one is not all pharmacists that provide it.
You have to be trained for it.
And also we have apart from our services of like giving out dispensing medication, we also services like smoking cessation, healthy lifestyle advice as well. Like in every chemist you have most chemists have a healthy living champion, somebody who is trained to help you with like weight exercise, weight loss, exercise, alcohol, diet, and things like that. You can go to your local chemist for advice like that.
Viewers, if you have joined us here on Let's Talk About Health, which is streaming live through Omega Live TV on Facebook and YouTube, we are looking into minor ailments which can be treated at your local pharmacy. That is if you are here in the UK. And I believe even in Ghana, it's something that pharmacists can still help you with. Today, it's a massively warm day here in London. We are nearly hitting 38 degrees. So it is really hot around here. But I hope you are learning a lot from this session, because medications are very crucial, and the management of it very crucial in the life of anybody who is on medication, isn't it? So you mentioned earlier, I think before we had that technical problem about is it a sexual health service?
We have a sexual health service as well. So that one is commissioned by the council.
Okay.
So basically it's for patients 13 to 24 years of age. So if you've had
13
to 24 years of age.
13. Right. So is it something they come by themselves, or do they come with parents for this kind of service?
No, you come by yourself. You come by yourself. But if you are less than, the age of consent is 16 years old. So if you are less than 16 years old, we have to go through some guidelines with you. And after that, after helping you, we have to refer you to child services as well. So basically, if you've had unprotected sex within 72 hours, we can give the morning after pill. There's one called Livonel or levonorgestrel, which you take. It's a one-off.
Hopefully, these are not over-the-counter medications.
No, you can. It's not something that you can self-select. OTC ones are something that you can just pick up.
What is OTC?
Over-the-counter medication.
Okay.
You can just pick them up. But you can get these ones behind the counter. The pharmacist can give them to you.
Right.
Apart from the service that we provide, you can also buy it. If you don't fall within the service group, you can buy it over the counter.
Okay.
But we still have to assess you anyway. We just don't give it out. We have to assess you. So there's another one which you can take within 120 hours, 5 days of unprotected sex. That one is called Ella1. Ella1. But with that one, you need to have a consultation with the pharmacist. You just don't come and pick it like candies and go home with it.
Right. So they do need that consultation.
They do need that consultation.
Yeah, like I always do, I get people to join in online to bring any questions on the floor, and I have so many people already here. Let me acknowledge a few. Abigail Ajiri, Abna Nyakwa. Abigail is just saying, let's try and eat a well-balanced diet. If we can always do that, that would be perfect, isn't it? But no matter what we do, at one point or the other, we will have interactions with drugs, or our family members will. We don't have a choice as such. Definitely you will have encounters with medication at some point. Dr. Sapir, called Otiba. Is it true that some medications do not dissolve fully in our system? Is it true that some medications do not dissolve?
This is another area as well. I don't know whether I can go into it a bit more.
I think you can. Everything that is like, there will be many people thinking about the same sort of thing. So if we can break it down, that would be helpful.
I mean, the first thing is that there are so drug interactions have got. When you say it doesn't dissolve, I'll put it this way. Drug interactions have got two main forms of it. And I don't want to go into too much pharmacology here, but there's one group that we call the pharmacokinetics group, and that involves absorption, as well as other things, absorption, distribution, metabolism, and excretion. So there are times where you can take two medications and one can affect the absorption of the other. And yes, that is true. When you say drugs don't absorb, I would like to know what is behind it. Maybe some medications haven't worked well. Maybe is that what he means by hasn't absorbed? But again, this is also another thing. Individuals, we metabolize medication differently.
Yeah.
Do you see? We've got some people who are normal metabolizers. We've got slow metabolizers. We've got fast metabolizers. And because of that, this is something that is there. You can have somebody who will take a medication, assuming two people, one is fast metabolizer, the other is not. If two of them accidentally take an overdose, the one who is a slow metabolizer is more likely to have serious side effects because it will accumulate. The one who is a fast metabolizer may go through with it. Do you see? So when he says drugs, most drugs, it's not all of them, obviously. Some will be excreted, the liver will affect some of them, but some will be absorbed, fat will take some of them. But generally speaking, all these things have been taken into account for the dosage regime. Do you see? They will be taken into account. But the effect on individuals are different. They will be slightly different because we have the enzyme that metabolize particular medications. For instance, if medication A is metabolized by enzyme B, they will come in different forms like B1, B2, B3, for instance. And B1 will be outside the range, very, very active. B2 could be the normal in most people in the population. B3 could be slow. You know, so if somebody is a slow metabolizer, they can take something and people, you take it, you are getting a side effect. I took it, I was fine.
Yeah.
Or somebody will say, this drug doesn't work for me, it doesn't touch me.
Yeah.
It's probably metabolizing it fast. You know,
and that is why these medication reviews are very, very important, and that is why it is so necessary for you to give as much information as possible when you are prescribed any medication at all. Very, very important. You do that. Abasma, Nana Asantua, Moses Odeneho Abibio, Linda Apia, Na Bedua, they are all watching. Will Peterson, Isumanjura. Well, I'm happy you are on live today. Ato Hayford is calling in, watching from Ghana. Pa Mensa is in London. Lydia Kwashi, really informative. So we will keep it going. Evelyn Asiedu, Ato Hayford, Peter Asari, and June Reed. Andy and team, well done. Currently, what vaccinations are needed before traveling to Africa? What anti-malarial medications are the best to have when traveling, and how do you take them?
So regarding the vaccinations, usually we go according to what the Department of Health recommends. So, for example, in Ghana, we use a website called Travel Pro.
Okay.
So, for example, in Ghana, you need hepatitis A vaccine, you need tetanus vaccine, you need typhoid vaccine, you need polio vaccine, and also yellow fever vaccine. So we will check whether you need boosters or not. Hep A is usually valid for life, so if you've had it in the past, you don't need to have it. Yellow fever is valid for life as well. So
it's valid for life.
It's valid for life as well. At first they said 10 years, but now it's lifelong.
It doesn't mean it's given if you've had it before.
Yeah, if you've had it before, that means you are covered. Yeah, okay. But you need a book. You need a book to say that you've had it. And
evidence.
Yeah, evidence to say
that haven't had it.
Yeah,
right.
And also there is the polio vaccine and tetanus vaccine. Those ones are valid for 10 years. And we have the typhoid vaccine. Typhoid vaccine, you can either get an injection or you can either get capsules.
Yeah.
That one is valid for 3 years.
Right.
That's for Ghana. And we have the anti-malarials as well. The anti-malarials, it depends on the individual. So we have mefloquine. Mefloquine is a weekly one. So that one, you usually take it for adults. You take 10 days before you go. The whole period while you are away, and 4 weeks after you come back, you still have to carry on taking it. It's not suitable for those with psychiatric problems, and also
so June,
those
I think
with
what I'll say,
those
because
with
we
epilepsy
won't
as
go
well.
into details, because people will say, "Oh, Andy said on Let's Talk About Health that you can take what queen?
Mefloquine, yeah.
Mefloquine.
So it all depends. It all depends on your condition, what medication you take, your age, and things like that.
That is what we are stressing here.
Yeah.
Everyone has to be assessed before they ingest anything.
Any medication.
Medication. So you need to go for a consultation, because he can't really answer this without knowing your allergic history and that kind of thing. You need more information for these things, isn't it?
Yeah,
and plus your destination as well.
Destination, that's correct. Absolutely.
See your pharmacist. You don't need to book an appointment. They can do a consultation with you, so they can make a safe choice with you.
Yeah.
Because doxycycline, for instance, is one of them that they give to people
for malaria.
It doesn't agree with me at all. You see, so as a person, I know I cannot have that as an option. You see, so everyone is different. So know what you are presenting with, know your allergic history, and then take it from there. Have a proper consultation. I think that will be the safest thing to do, isn't it? Yeah. So Frimpon, Isaac, Patricia, Isilfi Ado, and Indu Katrick, nice detailed information. Dalinda Wright, thank you very much. Dalinda Wright Hansen, they are all watching. We'll keep going. So I'll ask the producer, because in preparing, we will come back and finish off the remaining services, and I want us to finish off the program with the rest of the medication review. But I personally, in reading and prepping for this, looked at food and drug interactions. And some I knew, like offhand, but I was quite shocked at the other information. So if the producer can project some of the, so this website I got onto, it says e-drug search, and it says food drug interactions that you need to know. And actually it warns you as you read through that it will make you sick. It doesn't really mince words at all. It categorically states that if you do this, you will be sick. So if we can take time, producer, if you slow down a bit so I can look at them one after the other, because these are everyday things that we meet. And so you really need to know this. So if we can take the first one, which is milk. Milk, and what it's saying is that milk is a rich source of vitamin D, and obviously, especially for us living here in the UK, we definitely need it.
We do. Because
as black ethnic minority people, we know vitamin D is deficient. But today there's a lot out there. You can go and have a top up outside today. But let's look at this. It says milk is a rich source of vitamin D, but you should not drink it whilst taking antibiotics because it can cause you very serious problems. And I looked at the list, and some of these antibiotics are prescribed daily. They are things that we interact with every day if you have any infection. Obviously, here in the UK, antibiotic use is very monitored, very controlled, but I'm sure back home in Ghana and in other African countries and even worldwide, the control may not be as spot on as it is here. So it says it revealed, and this was to do is geriatric medicine, as in old people, because we know old people are prone to having lots of infections, and therefore they tend to be given a lot of antibiotic treatment. And it reveals that the calcium in dairy products makes it extremely difficult for your body to absorb antibiotics. And I will just highlight metronidazole, which is flagyl, is commonly prescribed in Ghana. Amoxicillin potassium, which is augmentin, is a broad spectrum antibiotic which is commonly prescribed. And then like cefalexin, ciprofloxacin, these are all medications that are prescribed very regularly. And producer, if you can please go up to number 2 for us, and we'll try and do this quickly because I think it's very important. So number 2, it was talking about alcohol. You should not drink alcohol while taking antihistamines. You see, and if you live here in the UK, you may be a very bad hay fever sufferer and will be taking antihistamines. And it says the primary reason physicians tell their patients to avoid drinking alcohol while taking aspirin and ibuprofen, that's also part of it. But in the case of the alcohol, matters can get serious if you mix alcohol with acetaminophen. These are drugs that are in
similar to paracetamol.
Yeah, similar to paracetamol and stuff like that. And that is just alcohol, And the number of times people take paracetamol, for instance, after having boozing and having a headache, And let's look at number 3. It's saying bananas are high in potassium and can cause heart palpitation. I'm not saying it's bad. I'm not saying bananas are bad, but they are rich in potassium. And I had a kidney patient here who pointed out clearly that if you are a kidney patient, you have to watch, because when you have problems with your kidney, your potassium levels are very importantly monitored, because anything with your electrolytes can cause problems. And we got that in bananas. But at the same time, it says when it's taken with ACE inhibitors. So I looked at that, and these are blood pressure control medication. And unfortunately for we Africans, we are high risk for blood pressure, and we are taking bananas. So you see, it's not just medication, drugs and the food we take in is very important. So if we come up as well, it's also saying that the potassium in the banana, please slow down a bit, producer. If you come down just a little bit to the number 3, it says the potassium can also cause a problem when you are on diuretics. Again, people who have say, heart failure, for instance, may be on furosemide to get rid of the fluid. So you see all the food interactions there. So we'll go through the list because I found it very, very useful. So if we can go on to number 4, we'll do this quickly and then we'll come back. Number 4 is grapefruit. And grapefruit, it says, is a delicious citrus fruit which poses serious threat if taken with medications for blood pressure. You see? So these things are really, really, you need to know what foods you can and cannot have when you are on certain kinds of medication. And it goes on to say it's vital to point out that grape juice can change the way your body metabolizes birth control pills. And how surprising is that if people are getting pregnant, you know, because their birth control pills did not quite work, but it's because they are actually taking grapefruit and antihistamines, which is like for hay fever and stuff like that, stomach acid blockers, thyroid replacement medications. So we go up to number 5. I want to do this quickly because I think it's very important. And for you to have a comprehensive read, just go to eDrug search and type in common food drug interactions, and you will see all these and take your time to look at it. So wheat bran also has an effect there. And again, it is digoxin, lanoxin. These are all for heart failure, you know, and heart, everything to do with your heart. So it is hardly surprising that we just die prematurely and a whole lot of things happen, isn't it, when we are not really in control. And then it says is it licorice or something like that? It says it's delicious, but the main ingredient can lower the body's potassium. You see, when it comes to potassium, too much of it is bad, too little of it is bad. So then it's like, how do you get a fine balance? Obviously, we talk about balanced diet all the time. So too much of everything is bad. And then we come to green leafy vegetables. You see, and when we look through the list, these will all make it, most of them will make it on a healthy diet menu. You see, so I was really shocked to see that. And let's look at number 7 in particular. Blood thinning medications like warfarin can interfere with vitamin K dependent clotting factors that takes place in your liver. Eating too many green leafy veggies like spinach, broccoli, lettuce can actually decrease the ability of the blood thinner to prevent clotting. I was so shocked to see the detail. You know, I knew some of them, but I was quite surprised to see some of them on here, and the fact that they are things that we take on a daily basis. I had a kidney patient here, and Mr. Jaja, hi Mr. Jaja, I hope you are watching. Thank you. I'm getting you back on here very soon. And he did mention that if you are a patient who suffers with kidney failure, mango is a no-go. You don't take mangoes because it can kill you off. The only time he takes mango is when he is going to be dialyzed soon after, or say whilst the dialysis is about to start, he takes it. So there is something in mango that he cannot or is not allowed. And even he mentioned about the green leafy vegetables, you know, and all these things make it in our diet, you know. As Africans, we like those contemporary stew and all those things, and yet they are very, very serious things to consider. So that was my little bit, you know, obviously in addition to all the information you guys shared with me. It was of particular interest to me because of the effects it can have on people on a daily basis. So we will carry on. Thanks for your patience in listening to that. But Indu Cartrick, I think is it a lady or gentleman?
Yeah, she's a lady.
Yeah.
She's one of my co-workers. Yeah.
Okay, yeah. I see. She's watching, and I think she's liking what she's seeing. Thank you.
Hello, Indu. Hello, all Britannia staff watching. Thanks for watching.
Yeah, you want to say big shout out to your workmates as well?
Well, yes, I think I've got Dr. Olu, I've got Mercy, might be watching. Yes, it must be a few people watching.
Yeah,
yes.
but it's fantastic. They are doing a very good job so far. This is all coming to you live by kind courtesy of Omega Live Multimedia, by Wild Remit, Cosmet Cocktails, Base, and Wache Joint. I need a whole lot of you to be sharing and starting your watch parties. Keep sharing, keep liking, and let's continue to educate our people. That is the focus of this show, to educate our people. So let's see. June Reed is saying, how useful is it to take vitamins? Sometimes one reads about eating well and forgetting about taking vitamins. Other times you are advised to take food supplements. Could you comment?
Okay, so generally speaking, in the UK, generally speaking, we don't advise supplements, but sometimes we do. I will only recommend supplements after a blood test. Personally, that is what I do.
And what's the reason for that?
I've seen this in practice. I have seen. I once saw a patient who was taking some supplements. I don't know which one. It was an African lady actually, and the level of her iron and vitamin B12 was just on the top of it, and that can be serious. Excess iron can be serious thing. So in the UK, because we generally, diet is good, you know. So I don't always recommend that you take vitamins just for taking sake. Really, I don't. But there are some people who need it. There are some group of patients who need it. There are some group of patients who, for instance, typical example, there are some people who have heavy menstrual bleeds every month.
Yeah.
The iron level go down. There have been patients like that who have had to take what I'll call prophylactic iron, just to keep it in shape. Then we got vitamin D, as we're talking about. There are some of us who need to take vitamin D, really. It's a matter of fact.
Especially in this COVID time.
Exactly.
We can't do anything these days without mentioning COVID.
Yes.
Is it necessary for people to
I
be
think
taking?
it is. I think, to be honest with you, it is recommended by NHS that black,
ethnic minority.
Yes, and then because of our skin type,
black Asian,
because of our skin type and the weather here, we should be taking vitamin D.
Yeah.
You know, Caucasians should be taking vitamin D during the winter period. In practice, you see it though. I see it in practice a lot.
Right.
Winter time, you've got patients coming in, they're extremely tired. Maybe you think is it thyroid? Is it what? You check blood tests and the vitamin D is very low. So it happens in practice. So certainly winter period is needed. But I think for those of us with dark skin, it's recommended that you take vitamin D.
Is it for those just outside of their usual birthplace country, like say Ghana? What is the situation for them?
I think those who are outside Ghana, is that what you mean?
Those who are, say, in Ghana, do they also fall in this category? Do they need to be taken?
Probably not, if they are having good diet. And that is where the question is. Do you see? If they are having good meals, then probably not, because the temperature,
there's enough sunshine.
There's enough sunshine, you know. And again, it comes down to, you can only generalize up to a point. In everything that we are doing, you can only generalize up to a point. But for a healthy person, fit and well, generally speaking, there's no need for vitamin supplements. If you're having a good diet and you are well, apart from the vitamin D, if you're in the UK that we mentioned.
In summertime, like now, do we still need to take it?
I think in summertime maybe it's not too that important. But in this particular time, it probably, if you are taking a low dose vitamin D, it probably wouldn't hurt. But also, it also depends
just because of COVID.
Just because of, but also depends on. I work indoors. I'm always in the
indoors.
So for somebody like me, I don't get a lot of sunshine. If somebody is outside all the time, maybe they'll be fine. For somebody like me, it is recommended. If I'm living in the UK, it's recommended that I take low dose vitamin D throughout the year.
So that is regardless of COVID?
That is regardless of COVID.
Right.
It's recommended that those of my skin color and Asians need to take obviously, I'm talking about those who don't have low vitamin D. If you've done a blood test, you have low vitamin D, we will deal with that. That is different.
Yeah.
If you don't have low vitamin D, it is recommended you take low dose vitamin D. For some of us living here throughout the year, it's recommended. Yeah.
Very recommended. Very necessary. Right. Edmond Bensa, Catherine Savage, Angela Nana Otu, Helena Kote, Francis Eninfo, Joyce Mantel, Alberta Otu. You are all watching. You need to ask questions. Don't just watch. Bring the questions while the specialists are here.
To be frank with you, we're looking at what you showed on the food.
Yeah.
And I think that is one why the monitoring bit is so important, isn't it?
Right.
Because, like you said, this have got, okay, so banana, they have vitamin, they have potassium, which is not great if you are taking, you said ACE inhibitor, because it can, potassium level can come up. But it's not for everybody. So if you are somebody on ACE inhibitor and you are asked to have a renal function check, do it. There are times where we are chasing people. You have to chase people for them to do it. Yeah. So at the end, monitoring is the key here, so that we know what is going on. Really, we need to do the monitoring when we are.
So I guess for those who are even in Ghana, you still need to be monitored.
Yes.
Yeah. Take charge of your body, my people. Take charge. Know your medication. You see, what beats my mind, even in this day and age, is the number of times I ask people who have been to see a clinician of some sort that what medication was given you, and they are like, I'm not sure what it is. You see, even in this information age, if I'm not talking about people who are not literate, I'm talking about literate people.
Yes.
And they do not even remember the name. At the moment, everyone has a phone. Yeah.
That's true.
Even kids have phones. You see, so if you are put on any medication, at least save it in your notes. Just write it in your notes and read a little bit about it, and so that at least you are equipped to know whether this is good for me. And that's the only way you can tell if something begins to go wrong, and then note when you were put on the medication. And we will go back to the medication review bit, because that really always strikes a nerve when that is mentioned. You see, because again, people simply don't know what they are taking, let alone what interactions it has with anything.
Yes, I know.
Yeah,
I know.
What would we say to that?
So I think I said a few things initially about the fact how important they are, and the fact that patients should really get involved with this and take charge of it. So I think in the UK there's a system that is working. It's not perfect, but there's a system that we have. But I don't know how this is in other countries. And I think this is something that patients should probably start really. It has become probably the cornerstone now in the way we look after patients, really, because let's be honest, most intervention that we do as clinicians, we use medication to do it.
Yeah.
And if you look at it, in the UK, about 50% of ladies are taking regular prescribed medication. Men, about 43%.
Wow.
If you take patients from 75 years going, about 70% of them are taking regular prescribed 3 or more medications. So it's something that is really part of us.
Yeah.
So I think it's important we show really serious interest in it.
Wow.
And I think it should be happening in other countries. People should really be asking more questions. I mean, there have been occasions where I've spoken to somebody in, say, Ghana, gone to the hospital, there was a guy I was speaking to, being given an eye drop for something. Well, the first thing is he didn't have a clue what was being treated. He couldn't tell me what had been prescribed.
Yeah.
So you can't even advise anything.
No.
So people need to know. You've been to see a doctor or a clinician. You've been given something to use. you must know something about it, at least.
Okay.
What is being treated, what is being managed.
Yeah. Anyway, so Atu Hayford, and I think I'll let Andy answer this one, is saying that this is something I always feel pharmacists should do when you are given a drug, as to when you should take it. That is the recommendation that goes with the medication. But at times before and after meals is not to be told, especially in my village. Yeah, I think I can probably get what they are trying to say, that the instructions are not always clear.
Not clear.
You know,
okay.
The instructions are not always clear. So what do they do in that case when the instructions are not clear? And then there's another one from Angela Nana Otu. Pharmacists should be advising people on the drugs and the foods to stay away from. The GPs will not tell you most of the time. Should this be happening? Should this be happening? And I think we probably touched on this a whole lot, isn't it? But do you have something to say about this particular, these two?
Yeah, regarding Mr. Hayford's one, I don't know where he's based. I think he's based in Ghana. Okay, in Ghana, I know in UK here we tell them, like, if you give antibiotics and it's supposed to, for example, penicillin is supposed to be taken before food. An hour before food or 2 hours after food, we will tell you. We will give you all the instructions. Even if we don't give it to you verbally, it's on the label how to take it. All the instructions are there.
Yeah.
So in Ghana, maybe to get some more information, you can ask the pharmacist. Try and always get your medication from a qualified pharmacist and ask them.
We're not talking about drugstore.
And that's you have to ask them whatever information you need to know about your medication. The pharmacists are well trained to handle everything, so just ask and they will answer you. And regarding Mrs. Otu's one, with that one too, I think maybe as pharmacists we have to be doing more to advise people on drug and food interactions, but most of the time we advise them anyway. Like we saw a clip on warfarin and green leafy vegetables. With that one we usually advise them. In the warfarin clinic we advise them usually amlodipine and grapefruit juice, vastatin and grapefruit juice, and things like that. We try to advise them, but you can always speak to your pharmacist.
I think the danger sometimes is when they know what you do, because I am on amlodipine, for high blood pressure, and until I read that, no one told me, because it is assumed that I'm a nurse and I would know, and it shouldn't be the case though. Because what if I don't know like if I haven't searched and I don't know, then I wouldn't know that. Because I am on amlodipine, I can't be having it.
Grapefruit juice and things
these
like
are some of the medications which are lifelong as well. Like amlodipine, you will be taking for a long time, isn't it? So then it means I cannot have grapefruit juice again. Is that what it is? Or can you say vary it? Like in my own case, I take amlodipine at night, because that was the advice given me, to be taken at night, that what I take. Can I have the grape juice in the daytime then, or in the morning?
I think there should be it should, because grapefruit juice basically is most of the time it's an enzyme inhibitor, right?
What about grape? You see, the juice is not so much my problem, but for the sake of healthy eating, I would like grapes. So
I think that one is different. There's
different.
The grapefruit, the citrus. It's that one. Is the grapefruit itself, and the grapefruit juice.
The one which is like a lemon.
That one. Yeah, that's the one. But normal grapes. Normal grapes are nice and they are good. They don't cause.
We can easily be confused as patients or be misinformed, not misinformed, but if the explanation is not clear, then I am going to take it, because he said grapefruit, so then I forget there is that grapes,
grapefruit juice.
Yeah, fantastic. So, viewers, I see. So you wanted to say something, Andy?
Regarding the binary elements, I wanted to touch on a very common condition that affects about 20% of the population.
Okay.
Which is
producer, if you can project that image for us.
Which is heartburn. Heartburn. Yeah, heartburn or acid reflux, which can be managed with lifestyle changes.
Okay.
If you change lifestyles, it's something common that people present with in a pharmacy.
Yeah.
So heartburn is,
if you look on the diagram, heartburn is when the acidic contents of the stomach moves into the esophagus. So the structure there is the stomach. That's a cross section of the stomach.
So that's that's this.
Yeah. And on top of the stomach, that tube is the esophagus.
In between the esophagus and the stomach, you have the lower esophageal sphincters. Basically, that's a valve of muscle which separates the esophagus and the stomach. So when you swallow food, the food goes from the esophagus into the stomach. And the valve closes, the muscle valve closes to prevent the backflow of the food. But usually, food can flow backwards into the esophagus, and this can be triggered by certain factors. First of all, you have lifestyles. If you drink a lot alcohol can cause a lot of heartburn. And you can get advice from your pharmacist as well. So basically, if you drink, the Department of Health advises that you take 2 units a day, maximum.
Just 2 units.
2 units a day, or 40 units a week. But that doesn't mean that you have to. You don't take anything during the weekend. The weekend you have all 40 units. You have to spread it.
Yeah.
So 2 units is it's a pint of beer is 2 units.
A pint of beer is 2 units.
Yeah.
How many, in terms of like mils, or how many glasses is that?
It's around 500 mils.
Mils, 500 mils.
Yeah, roughly,
okay.
Yeah. And
that's a good amount, isn't it? It's a lot.
Roughly. And
we'll be walking upside down.
You have wine as well. Wine to 175 mils. A glass of wine is 2 units. And those who drink spirits, a pub measure of spirit is 1 unit. So you're allowed to. So alcohol is one of them. So we ask that you drink in moderation.
Yeah.
The foods that you eat, if you eat a lot of fatty foods can affect it, which is not good.
You have to, isn't it?
Yeah, that's our specialty. So fatty foods, we have to cut down on fatty foods. We have to cut down on spicy foods, spicy and hot foods.
So if we should have a box and be taken,
a lot of
all of us will not eat.
But they are healthy. They are healthy things like vegetables, of course.
Right. Okay.
And you also have, if you eat a lot of caffeine-containing drinks, especially like these. A lot of people, Coca-Cola has caffeine in it. Red Bull has caffeine in it. And also,
there's a very bad practice. When we are in Ghana, we tend to drink water. We like drinking water. As soon as we come here, because of how cheap and the accessibility of these fizzy drinks, then we change, our habit of drinking water and replace it with fizzy caffeine-containing drinks, and that is a very a lot of us do it. And that is worth noting as well, isn't it? People do that a lot.
It's very true. So regarding the lifestyles, also obesity, if you're overweight, you tend to have a lot of heartburns as well. So we advise that you lose weight, you cut down on high fatty foods, you eat more fruits and vegetables. And so like common lifestyles. Also pregnancy is also associated with heartburns because of the hormonal changes, and also the baby pressing on the stomach.
As the pregnant uterus comes up.
As the uterus comes up.
Gets in the way of the stomach, isn't it? Even though, to be fair, some people are not pregnant, but they still have a
bump. That's
my tummy. It just presses and gets the stomach contents up.
Other factors are also like if you are stress and anxiety. So sometimes you don't have to stress unnecessarily. They can all affect the
They can all cause heartburn. So basically, it causes the acidic contents to move into the esophagus, or it leaks into the esophagus, causing like burns in the heart region.
Yeah.
It's also associated with sour taste in the mouth. So if you come to a chemist with heartburns, which is very common, it happens in 20% of the population.
Okay.
Yeah, we can help you. So we advise you on lifestyle changes, as we've already said.
So in this case, is it ethnic? It's got nothing. The percentage, it's got nothing to do with
it's more
ethnic.
It's more of a lifestyle thing. Like
I suppose because of our predisposition to very bad foods like spices and stuff, we will again top the chart.
Yeah, it's more of a lifestyle thing. And as I said, most chemists have a healthy living champion and a smoking cessation advisor who can advise you on the lifestyle changes. So if you come to a chemist with a common regular gastric or esophageal disease, we will advise you on lifestyle changes. If it's something that you have it regularly, we will have to refer you to your GP, because that becomes like a disease.
Yeah, because it may be the beginning of something.
Yeah, something
more
sinister.
serious.
Yeah, if you have difficulty in swallowing, if you have pain in swallowing. Yeah. So what we can also give over the counter is we can give antacids like Malox, Renis, Magacid. Yeah, those neutralizes the acid contents in the stomach, so that when they reflux, it's something that you can buy over the counter without a prescription. So when the food refluxes, you don't feel the heartburn.
But I will say, for the sake of this, if you've been listening from the beginning, I will say see a pharmacist.
Yeah, when you come to the chemist,
review everything, because they don't know what history you have. So please don't go buying Renis and all those antacids taken in the name of let's talk about health. Please see a pharmacist.
And secondly, we have the alginate like a Gaviscon, which forms a raft on top of the acidic content, so that when they reflux, it covers the lining of the esophagus. And we have the proton pump inhibitors, which is omeprazole, pantoprazole. And
those are by prescription, isn't it?
No, you can buy it over the counter. You can get it over the counter. Yeah, a low strength you can get over the counter, and Zantac as well.
Pharmacist.
Yeah, Zantac as well.
That's the message.
Those usually block the production of acid in the stomach. Yeah, so it decreases the acidity of the stomach. The stomach lining the stomach is well lined to handle acids, but the esophagus is not.
Yeah.
So if the food splashes regularly, that's when you get those symptoms.
And avoid late night eating as well.
Late night eating. Now, also one thing is for if you wear tight clothing, like maybe for example, you know you're a size 14, but you want to fit into a size 12 jeans.
Oh dear.
Yeah, that will cause like heartburn as well. Physically, you'll be pushing the contents of the stomach into the esophagus.
Okay, viewers, if you've joined in online, this is coming to you by kind courtesy of Omega House Multimedia, Omega Live TV, World Remit, Base, Cosmet Cocktails, and Wache Joint. So we have more and more people coming in to sponsor the show. So please keep sharing, keep liking our page. Get all your friends and family to hear this, because these are everyday stuff that could save someone's life. I have a few more people to acknowledge here. Alberta Odro, Abba Asma, Cornelius Kumasa, Joyce Mantiao, Gerprit Denjan, it's your colleague. Atu Hayford is asking a question, but there is one other important question. Constance Nipa, Marion Ajemai, Anita Asan, Nancy Ekwia Kwijifin, Alberta Awoche, Angela Nana Otu, Kwesi Koram, Godson William. Yeah, they are all watching, and of course my big sister Isiamon is always giving her maximum support and watching as well. There is a very important question from Evelyn Asiedu, and she is saying, she's a nurse, so obviously she understands these things. Please, can the two gentlemen educate the public about this for me? If one is given some medicines which is to be taking TDS is 3 times a day. if there's anything on your prescription that has been given, there's anything written you don't understand, ask before you leave the pharmacist. Because BD is twice a day, TDS 3 times a day, QDS 4 times a day. These are little things we think people know, but if we don't explain it to them, they wouldn't know what to do. So her question is, if she forgets to take the second one, will it be okay for her to take it with the third one? I mean, obviously, a treatment that has been prescribed as TDS, if it has been, she's missed 1 dose, can she take 2?
No.
Yeah.
No,
when a dose is missed, because I'm sure a lot of people do that. Yeah. Do you just omit that dose?
So what you are saying is that assuming you are taking whatever, say paracetamol, you are taking it 2 or 4 times a day or what, and then if you miss 1 dose, the next dose, instead of taking 1, you take the double dose. Is that what she means?
Yes.
That is not right.
That is not right.
No. It shouldn't be like that. No. If assuming you are supposed to take the medication 3 times a day, assuming you are taking something as serious as, I don't know, yeah, it could be antibiotic, but I'll go for a very serious thing, like maybe
blood pressure,
blood thinner, you know, yeah, it could be warfarin or could be anything. So if you miss a dose and when you remember you take double the dose, that can have serious implications. If you have missed it, you have missed it. What if it's due? If the other one is not due and you remembered it, obviously you will take it. But if the next dose is due, you made the other one, you don't take it together with it. So that will be overdosing. Like I said, drugs, the regime has been programmed in a way that as the body is getting rid of it, it's going down. The concentration is going down. That is when the next dose is due. So that will bring it up like that.
Yeah.
So if you, especially there are some medications where the difference between what we call toxic levels and the good levels is very small, very narrow. So in a case like that, if you do that, you straight away hit the toxic level. I mean, if somebody is taking digoxin, for instance, and they say they forgot it yesterday, oh, today I'm going to take 2. So it could, you know, so it shouldn't be like that.
It shouldn't be like that. And that is probably why people sometimes don't comply and put it down to it being a reaction. Whereas it was just a wrong technique or wrong way of taking the medication. So if you miss a dose, I mean, this happens a lot, like for birth control pills, for instance, isn't it? When people miss the dose, still to leave it, isn't it? Because if you miss it, when you come in for something like that, we would have mentioned that if you miss this, your protection is not there, and then we will tell you what to do. So if you miss the dose, you go to the next one, but there is something you need to do to protect you. So you know, so there is a backup for birth control, and what sort of backup? Because obviously this is quite important. So that would be, we would say use a condom. You know, so you will have to use a condom. You see, so a lot of these medications are working with your hormones and your enzymes and a whole lot of activities going on in your body, and the reason why you need to follow the required instructions, isn't it? And not assume you can do whatever with it. There is one particular drug, like when people are taking antibiotics or when people are taking any regular medication, say amlodipine, because hypertension is so common, and they are also taking, say, simvastatin, which is a cholesterol reducing medication. A lot of Africans in our age group, as in 50 plus, I am, so I can say that you are a young fine man, so maybe you haven't hit that yet. But yeah, if they are taking, say, simvastatin to lower cholesterol, and then they get prescribed an antibiotic like clarithromycin, you see, even in the hospital, sometimes people don't know that they are meant to omit the dose of the cholesterol tablet whilst they are taking clarithromycin, isn't it?
Yes. It's something that we usually advise them in our pharmacy, community pharmacy. If you come in and they've prescribed maybe clarithromycin or erythromycin for an infection, and you are on a statin, we usually advise you, or most of the time, or always, let me say always, we advise you to stop your statin while taking, because there's an interaction. It increases the statin levels, which can give side effects muscle ache.
Okay,
like
so
I think this will go to, saying that, I prescribe a lot of this, so I make sure that I write that on the prescription as well. So it should be everybody. The person prescribing should put these things in. The person who is giving it should, and then the patient should also know. We need to look at it like that.
Yeah.
So if those people who are listening to us, who are prescribers, they could be doctors, they could be pharmacists, they could be nurses. It would be a good thing for us not to assume that the pharmacist giving it will mention it.
Yeah.
We should write it. The pharmacist will say it as well. If the patient is in front of me, I tell the patient as well, so that we know that at every stage of it, this sort of information is being reinforced.
Yeah. So I think we'll be getting ready to round up very soon. But my concern is back home. Do you have any plans of going back home to help? Our people need help, seriously, not permanently, even if it's temporarily. Do you have any plans to help in any way at all?
Yes, to be frank, yes, certainly. I mean, I think Andy knows about this as well. I don't know whether it's a place to mention it, but I have been able to work with a few colleagues and been able to donate things like books to a few universities in Ghana.
That's wonderful.
So that is something that I am not there, but this is something that I can do. There was one time that I went to speak to the students. I've been to Ghana once, and I went to speak to students. Apart from telling them, also you want them to know that they can. You want to inspire them, isn't it? You also want to inspire people, and for them to pass the message on. You know, so. Hopefully we should be able to go once in a while and do something, and at least to pass some of the knowledge we've been fortunate enough to gain from here. Yes. Also pass it on.
They have to assure us that they will welcome us with wide arms open. You know,
especially helping like those selling medication, especially in. Like even drugstores, helping them, teaching them the medication, when to give the medication, not just selling for financial gains, helping those counter assistants in pharmacy, trying to train them on medication and interaction and all that we've been talking about on medication. It will help a lot. Just a little that we do will help a lot with.
So I'll take a few more questions. It says from Kwesi Kuram, please do vitamin D. I think it's just the dosage, the recommended dosage for vitamin D. And Abba Asma of Ran is also asking, can blood tablets, I guess blood thinning maybe, or no, blood, I'm not sure, blood tablets be taken for life, or you can be weaned off it when your blood pressure so blood pressure medication. You see, from a cardiac point of view, Abba, because that's my speciality, a lot of these cardiac medications are titrated, isn't it? They start from a very low dose and they work their way up, and they don't start from a big dose straight away because they don't know how it's going to affect your body. So normally they would start from, say, if somebody is taking a cardiac blood pressure control tablet and they can optimize it to say 10 milligrams, they start with 5 because generally they don't know how your body is going to cope with that high dose. So the advice, and I was just bringing this from because it says blood pressure, and from my cardiac point of view, that if you are put on any medication and it is your body doesn't agree, it's probably because the dose is too much at that time, and that is what the medication review is for, isn't it? So they can review your medication. It's not like you are reacting to it or anything. It's probably the dose that you are taking and the instruction that was given to you which you haven't followed. But the other question I want you to take with regards to her question is, are they for life?
Yes and no. And I'll explain why. I mean, another thing to this is this, and I think that will answer the question as well. So if somebody has a blood pressure and it was purely because they were not active, their weight was high, maybe they had put on weight, they were not active at the time, sometimes even because they were going through some stress, if all these things put together, and I can give examples of this. I've seen patients like that. They come, and then we'll go through this, and some of them have been off the medication because they have been extremely active, they've lost weight, and the blood pressure has come back to normal without medication. But it's not all medications. If somebody is on a medication for, say, as a cardiac nurse, for AF, they have AF. They will have AF. So it is likely that they will take it for life. You see. But if the lady is talking about blood pressure, if just blood pressure, I've seen patients who have had to stop medications because actually, as a matter of fact, they were getting dizzy from the medication that initially we put them on, because they had changed. They had lost weight. Some of them had changed jaws because of what was going on, and that can be brought up, including diabetes. We reduce, if those who have changed lifestyle, we tend to reduce the drug load. So that is possible. It's not everything, but there are some of them that
that's why I think lifestyle advice is very important, like watching your weight, your diet, exercise, and alcohol consumption as well. I also know people who've been on blood pressure medication, and because of lifestyle changes, they've stopped their blood pressure medication because their blood pressure was going very low, so they had to stop it. And,
I think we'll round off now, and I can't thank the two of you enough for taking your time to come and teach us, go through all drugs. Viewers, if you've been watching us live on Facebook and YouTube, this has come your way by kind courtesy of Omega House Multimedia, and with the sponsorship of World Remit, safe and most effective way of sending money to your friends and family abroad. They are into entrepreneurship training. Wache Joint in London at Seven Sisters, and also by Cosmet Cocktails. We are rounding off now. We have been looking into the services, all the services that you can get from your pharmacist in treating minor ailments, and we also took time to look into medication reviews. And I believe when it comes to medication reviews, we can go on and on and on. Bottom line is, take charge of your body. If you have any new drug prescribed, know everything to do with your medication. I remember Mr. Jaja, when he was here, that's the dialysis patient, he said he knows all the medication that he's taking from the 90s, with their doses, their strengths, everything about the medication. So please take full charge of your body, and know what you are taking in, as well as all that you get, like in terms of herbal medication. I think one thing we didn't particularly touch on was the concoctions that we take, because a lot of these drugs are made from some of these natural products, hibiscus and a whole lot of neem tree and stuff. Especially in this COVID era, you have to be careful as well what you take, because a lot of the effects that we are having may actually not be side effects at all. It is just because your medication has been reviewed for such a long time. It's been an awesome session, and I'm sure we can do this another time. So gentlemen, I say thank you so much for coming, Andy and Francis. It's been great, and I have thoroughly enjoyed and learned so much from it. Thank you to our producers here at Omega Live Multimedia, and for the entire Omega House team. Thank you to all our sponsors. Keep liking and sharing. Share. Let's get so many people to have the knowledge of what goes on with our health services. The next time we meet here, I have Dr. Robert Khan. That is in 2 weeks' time. Dr. Robert Khan is going to look into hypertension. It is always named as the silent killer, and it's one of the diseases that is just taking us out as Black ethnic minority groups. So we are going to start the series of all the different things that affect us so much as ethnic minorities. Dr. Khan will be here, and we will take apart the topic of hypertension. I have enjoyed this session, and I'm very grateful to all of you. If I haven't mentioned your name, trust me, I will acknowledge you next time we meet. So until we come your way again in 2 weeks' time, I say look after yourself. Check on your family and your friends back home, especially when they are on any medications. I will personally get people to review these. I'm sure if I contact them to ask for help, message me with all your problems when you come to medication, not at odd hours though, and I will try and find you the answer, so together we can improve on this health education program. I love you all, so stay safe. COVID is not over yet. The numbers keep going up. Protect yourself, work hard as if all depends on you, and pray hard as if all depends on God. On that note, I say have a wonderful 2 weeks till I meet you again. God bless.